Namaste. I'm Dr. Shwetha. I'm an obstetrician and gynecologist. I'm a fertility consultant as well. I practice at Janisthaa Fertility Center and Hospital, which is located at Basaveshwar, Nagar in Bangalore. I'm the managing director of Janisthaa Fertility Center and Hospital. Janisthaa. Why Janisthaa? What does Janisthaa mean? Janisthaa means desire. Most of the people come here with a desire to conceive, and that is why we chose the name as Janisthaa. Generally, when a person comes, it is not necessary that everyone is recommended IVF treatment. IVF treatment is the last resort when people are not able to conceive normally. So there are so many other alternative treatments for IVF. For example, if everything is normal and if they've been married for a very short time, maybe about 6 months or a year, so you try a timed intercourse cycle. So that means we give ovulation induction, give them tablets, do a follicular monitoring, and when the follicle is of the ideal size, we give them egg releasing injection and ask them to have intercourse at a particular time and days. So when we do this, the pregnancy rate is up to 6 to 8%, and this is the first step in the treatment when everything is normal. Suppose if they're not conceived, even with 4 or 5 cycles of ovulation induction and timed intercourse, then we step up to intrauterine insemination. So here what do we do is we give the woman injections and produce 1 or 2 follicles, and when the follicle is of the right size, we give an egg releasing injection and then place the processed sperm into the intrauterine cavity. So what do I mean by processed sperm is we process the ejaculate sample and do certain processing techniques in the IVF lab where good motile sperms are obtained, and these good motile sperms, which is free of all the debris and infection, this we will place in the uterine cavity. By doing so, the chances of egg and the sperm meeting is relatively high, and the pregnancy rate with IUI would be between 10 to 12% in each cycle. There is something called cumulative pregnancy rate. When a person undergoes IUI cycle for 3 times, the pregnancy rate increases to about say 40%. So when these two treatments doesn't work, then people generally opt for IVF.